This is Viewpoint.
Welcome to Viewpoint. I'm Doug Petcash. COVID-19 isn't in the news very much anymore, but it's still out there and people are still getting sick from it. Certainly not at the levels we saw in the summer and fall of 2021, though. As of June 12th of this year, 30 people with confirmed or suspected cases of COVID were hospitalized in Idaho. Now, compare that to September 24th of 2021, when the state had its highest number of patients hospitalized with confirmed or suspected cases of COVID at 793, just on that one day. We've come a long way since then. Such a long way that Johns Hopkins University of Medicine stopped collecting data on March 10th of 2023. It had been a major case tracking source since the start of the pandemic. On that date, Johns Hopkins reported Idaho had a total of 521,120 confirmed cases of COVID since the first two cases were reported here on March 13th of 2020. It also reported 5,416 COVID-related deaths of Idahoans. And last month, on May 11th, the federal government allowed the public health emergency for COVID-19 to expire. So now is a good time to take stock of the lessons learned from the pandemic. You know, what worked, what didn't, and what should we do when the next pandemic comes around, because experts say another pandemic is coming. The unknowns, though, are when, how big, and how bad. Two leading voices in educating, warning, and comforting the public about the dangers of the most virulent strains of the COVID, the best ways to protect ourselves, and the impacts of the virus on our healthcare systems have authored a new book, Preparing for the Next Global Outbreak, a guide to planning from the schoolhouse to the White House. It's published by Johns Hopkins University Press. Dr. David Pate is the retired president and CEO of St. Luke's Health System, was a member of Governor Little's coronavirus working group, and is a doctor of internal medicine. Dr. Ted Epperly is a family medicine physician, president and CEO of Full Circle Health, and served as a Central District Health Board member for 15 years. Their book is the focus of today's Viewpoint. My guests are Dr. David Pate to my immediate right and Dr. Ted Epperly. Gentlemen, thank you for being here today.
Our pleasure. Thanks for having us.
Well, Dr. Epperly, first of all, just how did this project come about?
Well, David and I were both working hard with COVID, him with the governor, me with the Central District Health Department and my organization, seeing patients, caring for the community. And David and I were both educators and speaking to the public quite a bit. So I called him up one day and I said, David, I hear you a lot. I'm dealing with this. You're dealing with this. Why don't we write a book? David immediately said yes to that because his wife had been on him for about 2 months to do the same thing. And so David and I have gotten along extremely well for over a decade. We've partnered very effectively, and we actually worked extremely well on this project.
So did you pitch it to Johns Hopkins, or did they come to you?
We pitched it to them. And so, you know, one of the things that's nice about going to an academic press is you're not competing with all the kind of sensational books and with the fiction books and all. So we went to them, and fortunately, they loved the concept, and so.
And the way I understand it, this is the book that Johns Hopkins is going to put out in this genre, this vein, right?
For this specific area about planning. They do also publish some other books. For example, they're publishing some on vaccines and so forth, but this is their big COVID book.
So, Dr. Epperly, what is the premise of the book? What did you set out to do?
The premise was really to take a look at what did we do well, what didn't we do well, so that we could learn from it. David and I were both working off of the premise that if we don't learn from the past, we're doomed to repeat it. And we wanted to have something out there that would actually be a guide to future generations, future people looking at the same problem, because we looked into it and couldn't find anything that would help us plan and prepare for this.
And Dr. Pate, what lessons did you learn in looking back, you know, from like the early government response to the situation?
Well, of course, one of the big things was terrible communication. We have to figure out a better job of how to communicate health information to people. Another big area was the fact that by the time countries were taking steps to, for example, travel bans and all, it was already too late.
Okay. And Dr. Epperly, you know, has there been a more political pandemic?
No. And I think it was all amplified, Doug, by social media. Whatever your viewpoint was on this was amplified in whatever news feed you got. And so the politicization of this became, I think, hugely magnified by the fact that we had social media ramping up all sectors of this.
And what impact did the polarization of the politics in our country at the time have on response?
It was incredibly destructive to the response. Instead of us pulling together as a nation, Doug, working together, we divided. We had camps that were just about equal in size, that believed in the science of this, and camps that didn't, camps that believed in wearing masks, camps that didn't. And the one key principle about a pandemic is that is a time to pull together as a nation, because if we all are working together, we're going to protect people. That's not what happened this time.
Did you understand the fears, though, of the vaccine when it first came out? Because it came out so quickly, relatively speaking, compared to other vaccines. It was a new type with the mRNA, not your traditional one. And so did you understand the hesitancy?
Oh, absolutely. But I think there was ways to manage through that, because there were also a lot of fears about getting the disease. And so, and I think it was just a problem with the messaging, but also the intentional anti-vax disinformation, and it just made it so it was not, we did not get sufficient uptake.
Well, I'm pretty sure you were on air 24/7, whether it was either on TV or radio, trying to dismiss the disinformation.
I tried.
Dr. Epperly, also, you write about the importance of messaging and having that unified voice. And we'll get to the recommendations from the book in the next segment. But was that really one of the big keys here, that whether it was federal, state, and local, there wasn't a unified voice?
Yes, absolutely, Doug. And I believe, so does David, that the CDC should have played a much larger role in this as kind of a nation's expert, if you will. The White House kind of fumbled the ball on that. The CDC shouldn't have. And if we'd had one source of truth that was refreshed constantly, so that, and with the humility of, hey, we're learning as we go here, none of us have been through this one before, we could have done a lot better. It would have been a beacon for people to have gone to for one common, consistent message. And we had a million different messages on this.
Yeah, and well, you know, here in Idaho alone, we have, 115, 120 school districts, I believe. You, Dr. Pate, advised West Ada, the state's largest school district, and advised some other schools as well. So just in looking the way it was the response in our schools and how it was handled, what did you learn, looking back over that, really 2-year period?
I think a couple things. One was that the school boards were ill prepared to deal with something of this magnitude, and really should have gone through a different planning process and engaging experts. They didn't engage enough, and they waited too long to do that. The second thing was that they got focused on where the noise was. Parents picketing or teachers threatening walkouts, instead of, and made it a binary decision, do we mask or not? There's so many other things they could have done, and they just got off the wrong track.
Okay. And obviously we saw the impacts on our healthcare system. Burnout was a huge problem with doctors, nurses, other staff workers, just working these incredibly long shifts with very sick people. For you, Dr. Epperly, still, as a working physician now, and what do you see that happened in our healthcare system that maybe was the biggest takeaway for you, and how this impacted our systems?
It's amazing. In the initial couple months of the pandemic, physicians and the healthcare team was seen as heroes. Mm-hmm. And shortly after that, we became villains. We became almost perpetrators of doing things to people that they didn't think needed to be done. It led to a lot of moral distress in physicians, nurses, and other members of the workforce team. We knew what we needed to do, wanted to do it, wanted to help people, but at the same time, people were extremely resistant to listening, to being a part of this. The isolation of this into ICUs also was destructive for families and for the healthcare team, because we wanted people to be together too. So it was a perfect storm, if you will.
What worked well, though? There were obviously healthcare systems have to be thinking that pandemics are possible.
Yeah, I think there were a lot of things that actually did go well. Operation Warp Speed, which developed the vaccine quickly, that was a good thing. The development of Paxlovid and certain medications to help with this, that went extremely well. I think we saw a lot of generational difference, too, in response. The millennials and the Gen Zs were much more favorable about following public health initiatives, masking being part of the solution versus the pushback that we saw. So there were good things that happened there. One other thing I'll just quickly mention was that Zoom meetings became really an efficient and effective way to get a lot of work done. So there were many good things that happened with this pandemic that came from it.
And you got to admire the healthcare workers, too, who just stuck it out.
Yeah.
Oh, yeah.
Yeah,
I mean,
yeah. And, you know, speaking of burnout, 63% of physicians and nurses at this point in time, Doug, are burned out. That is a terrible toll to take on the workforce. And that's something we're going to have to spend another decade with a healing process from this.
Really? Wow. Okay. Well, we're going to take a quick break right now, and we're going to continue the conversation with authors and doctors David Pate and Ted Epperly. They came out with more than 100 recommendations for dealing with the next pandemic in their book, Preparing for the Next Global Outbreak. We'll talk about those recommendations next on Viewpoint.
I'm Matt Rowley with Freedom Private Wealth. Imagine a 22% bonus in your retirement income account or a fixed rate 5.2% for 3 years. Get a no obligation consultation today. Call Freedom Private Wealth.
This is how legends are.
2024 Chevy Silverado HD with Duramax diesel. And the Chevy Silverado with powerful TurboMax engine. No matter what route you take, there's a Chevy truck to get you there. Find new roads. Or get 1.9% financing on all 2023 Silverado HD pickups. Or get $500 cash allowance on this Silverado HD. See your Treasure Valley Chevy dealers today.
Join us on Idaho Today, Thursdays at 12:30 for HealthLink Idaho, a segment featuring educational topics on how to keep you and your family safe and healthy. HealthLink Idaho, Thursdays on Idaho Today, sponsored by the Idaho Department of Health and Welfare. KTVB and Intermountain Hospital bring you Road to Recovery on Idaho Today, lighting the path from addiction to wellness so no one walks alone. Road to Recovery, brought to you by Intermountain Hospital.
Our idea of the perfect day? You, your best friend,
Yeah, buddy. You ready to run?
and Quattro all-wheel drive. Own the elements in the Audi Q5.
Let's go, buddy.
Get exceptional offers at your local Audi dealer.
I'm Matt Rowley with Freedom Private Wealth. Imagine sleeping well again and not worrying about your retirement savings holding up. So call me at Freedom Private Wealth.
And welcome back to Viewpoint. Today we're focusing on the lessons learned from the COVID-19 pandemic with the authors of this new book, Preparing for the Next Global Outbreak, a guide to planning from the schoolhouse to the White House. The news release for the book says, from the exam room to the Public Health Board meeting room to the state capitol, Pate and Epperly use their expertise to craft 117 specific recommendations that organizations and governments can implement now in order to better prepare for the future. My guests, once again, are retired St. Luke's president and CEO, Dr. David Pate, and family medicine physician and former member of the Central District Health Board, Dr. Ted Epperly. Dr. Epperly, first of all, what are a couple of the key recommendations that you came out with in terms of what our national, state, and local leaders need to do?
Several sets of recommendations that we put forth, Doug, had to do with leadership and communication. At a time of a pandemic like this, a really good leader will bring a nation together, get the people working together. We didn't see that happen during this pandemic, both at the federal level, but also at the state level. Community level, we struggled with some of this. What a good leader does at a time like this is builds a good team, listens effectively to them, and uses a fair amount of humility in the recognition that we're not going to have all the answers, but we'll keep you posted. We'll get timely information and communication to you so that you can develop trust and confidence in our response. We saw a breakdown in that both leadership and the communication of that.
And obviously, this was a situation that in our generations hadn't been dealt with. And I believe both of you worked on the leadership portion of this book as well.
Yep.
What were your takeaways in that regard?
Well, and I think to your point, this is a whole different environment with social media. Before social media and all, you would go to people that you know are experts. Now with social media, anybody can profess to be an expert and anybody can spout anything, and it can get a lot of traction. So we have to stay away ahead of disinformation. The other thing is it's got to be, Dr. Epperly was talking about the leaders of the response. We have to be very clear in the communication. What do we know? What don't we know? And the CDC needed to do a better job of providing the evidence, making their website really clear. Here's what we're recommending. Here's the evidence. And also, I think in future, the CDC is going to have to start putting things on the website to dismiss disinformation things. We had so many things, if you think back to the ivermectin and all that, we should have been much more clear. Here's why that's wrong.
And Dr. Epperly, what were your recommendations? What are your recommendations for the healthcare system in our country?
Several recommendations had to do with how we train physicians and nurses. Not only do we need more in the system, this underscored the fact that we didn't have enough providers, but also in terms of both resilience and stress training as well. What we saw with the pandemic was a lot of moral distress in the physicians. And so the ability to have broader training, both through medical school and at the residency training level, to help deal with a pandemic or a mass emergency of this magnitude will go a long way, both in numbers, but also in the quality of education.
When you have a state like Idaho that has, historically had a doctor and nurse shortage, and then you throw in burnout with the pandemic, is there anything that really can be done to bolster the staffing levels?
Well, we've got to try. The ability to have an emergency backup system of retired physicians step forward. We've got a lot of really great physicians that are in retirement. We saw several of those physicians step forward. Same with nurses. If we had a deeper pool that could be accessed in a time of emergency, we made a recommendation in regards to that pool's development so that retired physicians know that in a national crisis like this, Doug, that it is a time to be asked and a time to respond.
Dr. Pate, how about for schools? You focused a lot on that. What are your recommendations? Just one or two key ones for schools here in Idaho and really across the country with the book.
Yeah, it's so important. We wrote a whole chapter, so there's lots. But I would say a couple of the big things. One is convene experts early and start, for example, with West Ada that you mentioned, I didn't get engaged until mid-October. It would have been a whole lot better if we started doing this over the summer and could work through it. The second thing that I think was important is when we put in our mitigation plans, we actually went to schools and did walkthroughs to see how is this being implemented? Are people still having challenges? Are they having questions? How is this working? Mm-hmm. And I think that was a real benefit to the schools.
And do you think now too that if they haven't already, that the districts, they've had this experience with the pandemic? I mean, to put that in code for their districts?
I don't think there's been very much learning. And in fact, my mind is boggled that there's some things that are apolitical, non-controversial, that schools still aren't doing. And I just shake my head.
Yeah. Dr. Epperly, we've said it, another pandemic will come.
Yes.
Why are people so sure of that, the experts?
A couple reasons. If you take a look at why that statement has been made, global warming and climate change is having an impact on people being moved closer and closer together as land mass starts to shrink, much more interaction with animals in different locations where there's much more packed living. And what happens is the viruses between animals and human beings start to get mixed, almost like a deck of cards. And there can be different variations that happen between animal and man to animal, and all of a sudden you've got a novel virus, a new card that's been generated with the mixing. And all of a sudden that new element gets thrown into the population, and because of this tight living and packing, it just jumps like fire.
And, Dr. Pate, the thing was the wait for the vaccine. A new one, if it's novel, not going to be a vaccine for that one either. So is it still, again, going to come down to, well, communication, but also masking, social distancing, and hand sanitizer?
Well, and also a more prompt response and also more research now. Dr. Epperly and I and lots of government agencies can give you a list of probably the 10 leading possibilities for the next pandemic. We ought to be doing research on those viruses now, developing antivirals, learning how to make even better vaccines.
When you say antivirals, you're talking about treatments rather than
treatments
vaccines,
and
right?
so forth, so that we're ready to go. And so we need to invest in the research. And what I fear is Congress and legislators are kind of done with COVID, which that's fine, be done with COVID.
Everybody's burned out.
But start focusing on the next one.
Yeah. And so where can folks get this book if they would like to check it out?
There's local bookstores that have it. You can get it online through Amazon. You can go to Johns Hopkins University Press online and get it and order it from there, wherever you like. And it's also in an ebook, and it's also on Audible.
All right. 15 seconds left, I guess. Real short answer. Are you optimistic about the future and the next pandemic?
I'm generally an optimistic person, but I am not optimistic about the response we'll have for the next pandemic because it doesn't appear we've learned much from this.
And you, Dr. Epperly?
4% is the U.S. population side. We had 25% of the deaths and hospitalizations from the pandemic. I remain optimistic, Doug, that we will learn from this, but we've got to have a concerted effort to know we need to learn.
Dr. Ted Epperly, Dr. David Pate, thank you so much for your time today.
Our pleasure.
And when we come back, we're turning back the clock 47 years to one of Idaho's worst disasters ever, the collapse of the Teton Dam. What happened and its devastating impact on the towns and people downstream.
I'm Matt Rowley with Freedom Private Wealth. Imagine sleeping well again and not worrying about your retirement savings holding up. So call me at Freedom Private Wealth.
It's your journey. Own every mile in the Hyundai Tucson with America's best warranty. Right now, get 0% APR on the Hyundai Tucson or the $750 bonus cash. See your Bronco Motors Hyundai dealer.
Thanks to Les Schwab Tires. I'm a confident backseat driver, but Mom's a little stressed about spending. Remember, deep breaths and watch your speed. Even though we're watching our wallets, Les Schwab is still watching out for our safety. So turn here.
Hurry in and save up to $200 on a set of 4 tires, plus get an extra $50 off with financing. Les Schwab Tires.
I'm Matt Rowley with Freedom Private Wealth. Today, inflation is eating away at retirement savings. You may have to work several more years before you can retire. Take a no-obligation meeting. Call me at Freedom Private Wealth.
Idaho has seen its fair share of disasters, fires, earthquakes, floods. In KTVB's 70-year existence, we've been on the forefront of covering a number of them. One of the biggest happened in June of 1976.
It was one of the biggest disasters in the history of Idaho.
12 miles northeast of Rexburg in eastern Idaho, the Teton Dam, completed in the fall of 1975, sat 305 feet high for only about 6 months. The reservoir above was created to provide flood control, hydropower, and supplemental irrigation water for more than 111,000 acres of farmland in the upper Snake River Valley. But on June 5, 1976,
it was a Saturday morning.
Calamity struck. KTVB General Manager Bob Kruger remembers that day and the call from Governor Cecil Andrus vividly.
I'm in the office and Sal's over in the newsroom, and my private line rang. And I picked it up, and it was a guy by the name of Governor Cecil D. Andrus. And he said, Kruger, cease. The Teton Dam just collapsed.
Bulldozer operators were working to plug what they considered minor holes where water was beginning to seep through. But by 11:52 a.m., those holes weren't minor anymore. Water began rushing through the dam to the tune of about 1 million cubic feet per second. In some places, water reached 30 feet high.
And I'm going over there, and if you can get Selesky to be out at the airport, he can go with us. Tell him to bring a camera, and he can go with us on the plane.
Sal Selesky was the KTVB news director at that time and one of the best photographers in the state of Idaho.
I went right over to Sal. Well, he grabs his stuff, and he's out at the airport.
300 square miles were flooded. Within 2 hours, Sugar City was under 15 feet of water. By 8 p.m., the reservoir had completely emptied. 80 billion gallons of water. 11 people were killed, homes and cars were carried away by the floodwaters, and 2/3 of the 9,000 Rexburg residents were left homeless. It caused more than $400 million in property damage.
And we came back, and he had some great footage, obviously, taken from the airplane and the water all over out there at the dam that had broken. And what we did, we shared a lot of that film with our competitor. And because we were the only ones on board. Right. I'm not even sure there was anybody on board from the newspaper. But Sal was there.
Selesky eventually turned all of that footage into a 30-minute special the very next day. Investigators later determined the collapse was due to a series of flaws in the design and construction of the dam. In the 47 years since the collapse, there has been no attempt to rebuild the Teton Dam. The water took 3 days to reach American Falls, 70 miles away. That's where it finally stopped, thanks to the dam there. After the collapse, the U.S. Bureau of Reclamation instituted the Dam Safety Program. It's now used as a worldwide standard for every new dam built. That is all of our time for this week's Viewpoint. Thank you so much for watching today. I'm Doug Petcash. I'll see you tonight on the Sunday News at 5 and 10, and then right back here next Sunday morning for another Viewpoint. Enjoy your day.